So today we have with us Dr. Shrikant and Dr. Rohini, and they both are practicing in Mumbai, Maharashtra. We're going to be covering the very prominent topic of these days, which is none other than prostate cancer. Very welcome.
Thank you.
So the very first question which comes to my mind is why there is a constant rise when it comes to the diagnosis or when it comes to the patient these days, where this is a rise of the cases.
What is rise in prostate cancer?
Yeah.
Okay. That's because see, prostate cancer is a disease or is a
Right.
cancer of elderly, essentially elderly, and nowadays people are living longer, and that is how in India the incidence has increased. And apart from that, whatever environmental changes are there, like everywhere in cancer, everywhere, they are the things which are affecting the incidence of prostate cancer, and it's on the increase.
Well, I would also like to ask you, ma'am, when we are talking about prostate cancer, what makes it very important for a patient to make it a diagnosed case? Because if we are delaying the process, what could be the complications of the prostate cancer?
Well, I think this question you should ask to Dr.
Okay,
Doctor,
I'll
yes,
tell you. See, the reason is in India, in our country, the diagnosis of prostate cancer in a late stage is extremely common. In our country, almost 75 to 80% of the patients are diagnosed with prostate cancer when it is advanced or when it is spread already. As against that, in many countries, advanced countries or Western countries, the diagnosis is done in 20% of the patients where it is localized disease. So, in 20% of the patients where it is advanced disease. So that is the statistics today, that in our country the diagnosis is extremely late, 80% are diagnosed late, and in abroad, Western countries, only 20% are diagnosed late. So that is why awareness of finding out if there is a prostate cancer is extremely important.
Right.
And for that, there is one simple test, that is a blood test, and one examination by a qualified urologist every yearly after the age of 50. That is something which will be the guidelines or which will be the advice to common man, that after the age of 50, every year one should do his PSA and one must visit a qualified urologist and get examined.
Right. I would also like to ask you when the surgical intervention becomes necessity, and is there any possibility that we can avoid it?
Now see, basically it is like this. In prostate cancer, in advanced disease, surgical intervention cannot be done because it is beyond that.
Yeah.
But in early stage, if it is diagnosed in early stage, then radical treatment, complete removal of the prostate is possible. However, one should remember that even in delayed cases, when it is advanced disease also, extremely good treatment is available nowadays. Previously, radiation or chemotherapy or various medicines were not that very commonly available. Now, lot of different kind of medicines are available even in metastatic or a disease which is spread beyond the prostate.
All right. I would also like you to answer this question because there are patients who think that if we have a prostate cancer, is it possible to cure it with medicines only if it is diagnosed at an early stage?
Not really. If it is localized disease, always complete cure is possible with either like radical radiation therapy, complete radiation therapy, or one should go ahead with radical surgery.
Right.
But only with medicines, it's not something which can be completely cured.
Okay.
But the medicine has a tremendous role in patients who have got advanced disease, who have got metastatic disease. And in prostate cancer, the metastases generally are at two places. One is lymph node metastasis, and second one is known as osseous metastasis, that is in the bones.
Right.
The metastasis in the bones is an extremely common thing in prostate cancer. And for both these metastatic disease, good amount of treatment, various treatments are nowadays available.
Any lifestyle modification we can do?
Lifestyle modification, nothing much, but those who have high saturated fat in their diet, or those essentially to some extent non-vegetarians, there the incidence is supposed to be high. And to lifestyle diseases, lot of things have been discussed about it now, like every day having some tofu like thing, or vitamin E or zinc. Various things have been tried, and they have said that, or for that matter, even red wine. all these things would prevent prostate cancer incidence, but nothing has been proved completely, you know, there is no evidence based for that.
Anything you would like to add to the conversation which I might have missed about prostate cancer?
And I would say that only one important thing is that awareness of prostate cancer is very important in common man, for the common people, and in that, as I said, that after the age of 50, one must, you know, investigate yourself, because in early stage of prostate cancer, there are no symptoms at all. There is no symptom at all which will indicate that there could be prostate cancer. It's only investigation. It's only, you know, some kind of test that only can give you the diagnosis in early stage.
Thank you. Thank you so much,
Thank
sir,
you.
for your valuable insights. Thank you.
Thank you.